Thanks for joining us on Not Boring CEs, where we don't think you should be bored to death while getting your continuing ed. Keep listening here, then hop over to notboringces.com to get all your online CE credits. All right, y'all, let's get to learning. Dr. Alexa Bonacquisti is a clinical psychologist with expertise in reproductive health, psychology, and perinatal mental health. She is certified in perinatal mental health, PMHC, for Postpartum Support International, and she has nearly 15 years of experience providing psychological assessment and treatment to women across the lifespan, with specific expertise in treating perinatal mood and anxiety disorders and supporting women with the transition to parenthood. She also has experience working with women and families who are navigating stressful reproductive life events, such as pregnancy loss, infertility, birth trauma, and infant admission to a neonatal intensive care unit. Dr. Bonacquisti earned her PhD in clinical psychology at Drexel University with a concentration in health psychology. She completed an APA-accredited clinical internship at the University of North Carolina School of Medicine in Chapel Hill, specializing in women's mental health and behavioral medicine. Her postdoctoral fellowship focused on perinatal mental health in Drexel University's Department of Psychology and Mother-Baby Connections program. As a licensed psychologist and assistant professor of clinical psychology at Philadelphia College of Osteopathic Medicine, Dr. Bonacquisti's clinical and research interests focus on reproductive-related mood and anxiety disorders and mental health outcomes that occur in the context of reproductive functioning and coping with stressful reproductive events. In addition, she's interested in developing and evaluating innovative psychological treatments in these contexts, such as the use of acceptance and commitment therapy during the perinatal period. Dr. Bonacquisti is dedicated to the provision of evidence-based interventions and empathetic clinical care. Her clinical work focuses on treating women across the lifespan with an emphasis on the psychological aspects of the reproductive journey. Welcome back to Not Boring CEs. I'm here with Alexa Bonacquisti, and we are going to be talking about using acceptance and commitment therapy for perinatal mental health. I'm excited as somebody who struggled with PPD, postpartum depression, back with my first daughter, gosh, almost 11 years ago. And that subsequently made me terrified that I would have it again with my second. But I got really good care, and I want there to be more people out there providing really good care so everybody has the benefit of what I was able to experience during one of the darkest parts of my entire life. So thank you for being here, Alexa. I really appreciate it.
Yes, I'm so excited to be here. Thank you for having me, and for sharing, your personal experience, because I think that is something so many women go through that and don't know that other people are feeling the same way. And I think it's important, to talk about it. So I'm really glad to be here with you today.
Yay! Awesome. Well, where should we start? Should we kind of first just do some definitions or some explanation of perinatal mental health? Topics, diagnoses, issues. Can we start there?
Yep, absolutely. Yeah, so when we talk about the perinatal period, typically the term perinatal refers to pregnancy and up to like 1 year postpartum. The definitions kind of vary depending upon, different settings and things like that. And then you'll typically hear people talk about postpartum, which is the period after delivery, and kind of thinking about different stressors and challenges that happen during that time frame as well. So that's sort of what we're thinking about as far as terminology with respect to this time period and this transition.
Absolutely. And so there are a lot of things going on with the perinatal experience that might not be happening just in somebody's non-perinatal experience, their day-to-day lives. Can we talk about that and how that contributes to psychological distress?
Yes. So I think it's important to think about the broad range of experiences that individuals may have during pregnancy and then in the transition to parenthood. So I can talk to you a little bit about some of the psychological symptoms or concerns or diagnoses that we might see, and then maybe connect that with like some of the aspects of the perinatal experience that I think exacerbate or contribute to that. So a lot of people know about postpartum depression, and I think There's been a lot of advocacy and a lot of attention to that topic in the last maybe, 20 years or so. Still a lot of work that needs to be done and a lot of awareness that we still need to bring about. But I think a lot of people are more aware of postpartum depression, which refers to depressed mood, sadness, lack of interest or pleasure in things that you used to enjoy, irritability, sleep disturbances, which is always challenging when we have a newborn. So that kind of that symptom can be a little tricky to assess there. Changes in appetite, feelings of guilt and worthlessness and shame, and sometimes suicidal thoughts or suicidal attempts. So a lot of different things that can happen in terms of depression. And we see that there's a range. So some people may experience depressive symptoms that wouldn't necessarily meet criteria for a psychiatric diagnosis, but they're still affecting their life and their functioning. And so we kind of look at it like on a continuum where people may experience that. And then another really common experience during the perinatal period is anxiety. So it's often comorbid with depression. It's often, I think, recognized less frequently, than we might recognize depression. I think anxiety in some ways, it's like become more of a normative experience. Like, oh yeah, of course, you're a new mom, you're anxious, but it can be really debilitating. It can really negatively affect functioning. And so what we see with anxiety is, just frequent worries, rumination, sometimes like avoidance of different activities or experiences, which can ultimately, really affect, again, people's functioning and their overall well-being.
Yeah, and I think about how so much of this is not talked about. Like I know I was kind of afraid to say out loud all the things I was thinking and feeling. And everything's disrupted. Your hormones are out the window, your like sleep is out the window. You're already not your quote unquote normal self having just had a baby. To be able to gather your typical internal resources to reach out to the people that you love and let them know you're struggling. And it feels very common to me. Like just off the top of my head, I've got an acquaintance who had perinatal OCD. I had a close friend who had perinatal psychosis, and like big deal things that like take over your whole life, and can really color the way that you are looking at being a parent, especially if it's your first time as a parent.
Yeah, absolutely. Yeah, I think that kind of connects to this idea of like, what is it about the postpartum or the perinatal period that uniquely contributes to psychological distress? And I think a lot of what you're saying in terms of some of the stigma around it and people feeling hesitant to disclose what's truly happening because of the shame or the guilt that they may experience around that. And also thinking about, what are so we talked about depression and anxiety, but we certainly see perinatal OCD, perinatal PTSD, perinatal psychosis. Like there's a range of, even bipolar disorder, like a range of different symptoms and experiences that can happen during the postpartum period that either are like an exacerbation of pre-existing symptoms or sometimes a new onset of symptoms. And so I sort of really think about it, thinking about like the unique kind of aspects of the perinatal period from like a biopsychosocial perspective. So considering from the biological contribution, like the hormonal shift that happens, which some individuals are really uniquely vulnerable to that change in hormones. We kind of see that over the course of pregnancy, progesterone and estrogen are gradually increasing. And then at the time of delivery, there's a pretty dramatic drop off in those hormones. And some people are just uniquely vulnerable to that shift in hormones, which can exacerbate psychiatric symptoms or cause some of those disturbances in mood and functioning.
Mhm.
But we also see just like the physical changes, right? Like your body looks different, feels different, the physical recovery that's required after birth.
Yeah, which nobody talks about. Like I felt so prepared for the actual birth experience, but nobody was like, "And then you're going to be wearing a diaper for like weeks and
Yes.
like it's going to be a mess and it's all going to hurt and you're not going to sleep and all of it."
Yes,
Yeah.
nobody is prepared for that. And I talk with so many clients who feel really, yeah, shocked and like just they had thought so much about the birth and like taking care of the baby, but didn't think
Mhm.
about what is this going to feel like for me? And yeah, the physical recovery can be incredibly challenging. And then doing all that like without sleeping and,
Mhm.
taking care of a newborn is really hard.
Yeah, absolutely. And I don't think that I appreciated how powerful hormones were until my postpartum depression experience,
Mhm.
because all like this was a wanted pregnancy. This was a baby we had like hoped for. We were financially set up. We were emotionally as ready as one can be to be a parent. Like we had everything we wanted. And yet I was battling not just driving down the street and never coming back. Like that was my darkness. It wasn't, thank goodness, it wasn't suicidal ideation or attempts, but it was like this baby would honestly be better off without me because I'm such a awful mother. And
Mhm.
like, I mean, she's like 2 weeks old. Like I haven't even had a chance to be an awful mother, if I was going to be one. I was just doing my best, but I knew logically because of my training as a therapist, like, okay, this is probably PPD, but I didn't have any clue what to do with that. And still wouldn't, if somebody came into my office with PPD, I'd be referring them right out because it sinks into my heart a little too much. It's still too close.
Yes, yes. And it's really scary and overwhelming. And those
Mhm.
thoughts are very common. This thought that
Yeah.
I'm not a good mom, yeah, the baby would be better off without me. And even if that doesn't move into active suicidal ideation, what
Mhm.
does that kind of thought do in terms of your behavior and your bonding with the baby and just your quality of life and your functioning?
Mhm.
And it is really scary and overwhelming. And it does kind of happen for a lot of people, like very quickly, um, with,
Mhm.
with your experience.
Yeah.
Yeah. And that kind of gets into like the psychological pieces. So we talked about the biology, the psychological aspect, the thoughts, the emotions, the attributions that you make and the interpretations, that you make, that can certainly contribute to increased distress. This feeling of like, this is supposed to be the most joyful time in my life. Like you were saying, like
Mhm.
we're set up, we wanted this baby, we planned for this. And then when it doesn't feel the way you imagined,
Mhm.
people are just like, that's such a shift in expectations and perspectives that can feel really, really challenging and really
Mhm.
upsetting.
Yeah, absolutely. And shameful. Like it goes back to that shame piece and not talking about it because everybody that's visiting you is like, "Oh, are you so happy?" And you just say yes because like you don't want to be like, "No." This is the worst I've felt in my life. Because it's not what's expected. And then what are those people gonna do about it? You know?
Right, exactly. And you feel really alone and really isolated
Mhm.
and start to feel like there's something wrong with you, you made a mistake, you shouldn't be a mother, or, and that does also really, then it becomes very cyclical in terms of
Mhm.
how it continues to manifest.
Yeah.
Mhm.
And I think it's really important for providers to know that there is data that shows that certain people are going to be more um, kind of set up for postpartum depression. It doesn't mean they're going to get it necessarily, but if you've got a client who has struggled with an eating disorder in the past or is currently struggling with an eating disorder or made like major depressive disorder, are there other kinds of disorders or diagnoses or experiences that can really lay a groundwork or make somebody predisposed to a perinatal mental health condition?
Yes. Yeah, I think it's really important to look at somebody's psychological history and also their prior experiences, their learning history, right? Just the context of their life, because there are certainly, we have evidence to suggest that there are certainly experiences and diagnoses and symptoms that might predispose someone to having challenges during the postpartum period. So certainly a history of depression and anxiety or OCD or eating disorder. So any kind of psychiatric history might, the reproductive kind of trigger might exacerbate or lead to like a new episode of those, symptoms. So doesn't happen for everybody, nothing's a guarantee, but it's kind of something that you might want to think about and maybe be prepared for. I always encourage for, pregnant people to get into therapy during the pregnancy, because then you can build up that support and
Mhm.
start to plan and have that support established before, you deliver.
Mhm.
So that's sometimes can kind of help with that process. And then I also think about individuals who have had reproductive, stressors. So people who've experienced infertility or pregnancy loss, people who have had, any kind of traumatic history also might be predisposed to having some different challenges during the postpartum period.
Mhm.
So kind of thinking about what that looks like, people who've experienced a traumatic birth and
Mhm.
the implications of that. So
Yeah.
yeah, I think there's a lot then, yeah, can kind of contribute to just that feeling of this is not looking like how I imagined, like I should be happy, I should be feeling differently. And then that shame and guilt, that comes from that.
Mhm. Are breastfeeding issues also correlated?
Yeah, so it's very interesting, the literature on breastfeeding and how the like what that looks like in terms of mental health outcomes.
Mhm.
Um, I mean, I have noticed just in my clinical practice that there's a lot of, and this also kind of gets to that social part of like the expectations and the messages that people receive about the way they should be feeding their baby and like what's
Mhm.
the best way to do it. And that can cause a lot of anxiety and
Mhm.
a lot of obsessional kinds of thoughts and behaviors.
Yeah.
So sometimes those messages, yeah, I think can create a lot of stress and also put a lot of pressure on new mothers who are maybe wanting to breastfeed but finding it really challenging and having a lot of anxiety and distress around that.
Yeah. Yeah.
Yeah, yeah.
So if it just really feels like there's just this gauntlet that mothers have to run through in a very particular way throughout their life, pregnancy and postpartum, in order to avoid a perinatal mood disorder. I mean, it's not the majority of women who experience a perinatal mood disorder, but it's still like it feels like a lot of things have to fall into place.
Yes.
And yeah, at a very messy time in life.
It is, right? It's a huge identity shift. It's a huge life shift. It's just a change in perspective. There's more expectations, more demands, so there's a lot that I think everybody feels that to some degree. And then for some people, it is more severe and more significant, which would, warrant the more of the kind of diagnosis of a perinatal mood or anxiety disorder.
Mhm.
Mhm.
Yeah, so I'm thinking about like different modalities, and I know you're a ACT therapist and acceptance and commitment therapist. Um, can we talk about how the ACT perspective differs from some other approaches? Um, and maybe if there's anything that works in conjunction, like psychopharmacology or something like that.
Yeah, yeah, sure. Yeah, so ACT is the third wave behavioral therapy, and ACT really emphasizes psychological flexibility and acceptance of both internal and also external experiences, while really emphasizing the use of goals and values to guide behavior change.
Mhm.
So I think there's a number of different ways that ACT it may be uniquely like well suited to treating postpartum distress. We see that there's a lot of similarities in terms of ACT and other kinds of modalities, but then some unique aspects where it looks a little bit of a departure from other types of treatments. And so we have really good evidence to suggest there are a number of types of therapies and interventions that are effective. And ACT, I think, at least in my experience and the research I've done and my own practice, is that it offers like a unique perspective or a different way of looking at some of these problems, and thinking about it from that new perspective can be really helpful during this period of transition and upheaval for so many individuals. So I think a couple ways that it really differs. One, thinking about that idea of the shame and guilt and the stigma.
Mhm.
And some of the, ACT talks about this difference between like primary emotion, so like the response that you have, and then like the judgment that you have about your own response or your own
Mhm.
thoughts, your own emotions. And that's really what is unworkable. So it's not like the initial emotion that you have, but it's the judgment that you make of it.
Right.
Where you start to say, oh, I'm not enjoying this. I'm not happy. I'm a bad mom. And this
Mhm.
means this and that, and then that is kind of problematic. ACT also really emphasizes noticing and becoming aware of our thoughts without making attempts to change them or to
Mhm.
eliminate or suppress or avoid them. So that might look different from some other types of therapies that are focused on like looking at evidence and trying to change thoughts, whereas ACT is more about, the thought is what it is, and we can let it be there, and we don't have to engage with it. What we want to do is notice it and acknowledge it, and then turn towards our values and what is most important to us, rather than getting really caught up in that thought and
Mhm.
what it means and how we want to change it. So I think that can be really helpful for postpartum moms.
Yeah, absolutely.
Mhm.
And isn't something that they can kind of just start doing on their own in most cases? Like I'm assuming that like therapy or or a friend who just is psychologically minded in this way can be really instrumental in helping them grasp that, instead of just their brain feels like a scrambled egg anyway and trying to like sort this out on their own.
Yes, definitely. Yeah, I think it is really approachable. Like, I think
Hmm.
it does make a lot of sense on the surface for
Hmm.
people when I explain this to them. This idea that we can have this thought, I'm a bad mom. And what does that thought make us want to do? It makes us want to maybe withdraw from the baby or have somebody else take care of the baby. Well, we can have that thought and we can still go and hold the baby and rock the baby. And that thought doesn't have to be related to our behaviors. I
Hmm.
think that concept is really helpful for so many people.
Absolutely.
Yep. Yeah.
Yeah. And I think, I mean, I interact with non-perinatal people. I think about how it's also equally effective. But
Mhm.
I think because somebody's perinatal, we also know their hormones are all over the place. And that can be another kind of like explanation for why that thought is not actually them. Like they are not that thought. It's like we can further distance it by being like, right now your hormones are wackadoo. And
Yep.
it's really having you invest in these thoughts that are just thoughts. They're not
Yeah.
you.
Yeah.
Um, so this is, I guess, one good thing about hormones being wild.
Exactly. Yeah, I always say like this is a story that your mind is telling you.
Hmm.
And yeah, I mean I love that of like, yeah, your hormones, there's a lot of reasons why your mind is creating that thought.
Hmm.
But just because you think something doesn't mean it's true. It doesn't mean that it reflects anything about reality. Like we can have many, many thoughts, and that's just what our mind does. It creates thoughts, and it doesn't mean that we have to do anything with it, or doesn't mean that we have to buy into it or believe it. And just noticing the flow and that conscious awareness of the thoughts popping into our mind, and like that's just, there's that thought. And in ACT, we call them like sticky thoughts.
Mm-hmm.
So everybody has these thoughts that for them are just particularly sticky, meaning they pop up frequently, or, and just noticing like, yeah, that's that thing that my mind does. And that's okay. Like, I don't have to do anything with that.
Yeah. And I'm thinking about how like they can probably identify sticky thoughts from before this phase of their life, right? But if
Mhm.
this is their first time being a parent, this is a brand new sticky thought, and it is like glue. It's not a post-it sticky, it's like glue sticky. And how probably relating it back to other sticky thoughts that they've had throughout their life as like this is similar to I'm not smart enough, or that kind of thing. This is just the perinatal version.
Exactly. Yes, I think that's a really good way of describing it. Is absolutely like you've had these experiences before, and what's happening now is you're in a totally new role and a new situation, and you've never done this before. And even if you've had another baby, even if this is like your second kid, you still have never parented this baby and this experience and this life and this time, and so
Mhm.
everything is new. And it makes sense that you're feeling the way that you're feeling and having the thoughts that you're feeling,
Mhm.
or having the thoughts that you're having, and kind of we can connect that to feelings and thoughts that you've had before. And
Mhm.
and I think that it can be really illuminating for people to see that pattern.
Absolutely. Yeah.
Yeah. Yeah.
Yeah. What kinds of resistance do you see that's maybe different for a perinatal population
Mhm.
with some of these techniques that you don't see as often in a non-perinatal population?
Mhm. Yeah, I think some of the challenges or areas of resistance might kind of come around just like increased demands, lack of time, uh, the shift in identity and roles that happen. So a lot of the coping skills or the resources that people may have had previously, now all of a sudden the context has changed. And so they're not able to engage in the same way that they were before or perform the same kinds of tasks. So I think that can be a challenging area. And like one of the ACT concepts is present moment awareness and mindfulness, which is used in a lot of different kinds of therapies. And I think patients will be like, well, I don't have time to like meditate for 20 minutes, or, like I have a new baby, I can't. And so we talk about, well, how can you incorporate this mindfulness into activities that you're already doing?
Mhm.
So like when you're holding the baby, or, it's 3 a.m. and you're feeding the baby, instead of sitting there and like scrolling on your phone and like Googling things and like,
Mhm.
looking on social media and getting and comparing yourself to others, is there a way that we can tap into that present moment awareness? And I wonder if we could be curious about what that would feel like and how it might feel different. So can
Mhm.
you look at the baby? Can you notice, what does the baby look like? What do they smell like? What's happening around you in this room? And so it's an activity that like you're already doing. You're already up at 3 a.m. feeding the baby.
Mhm.
And we do that in a mindful way. So like that's an example of sort of how we might work around some of the challenges or the resistance, that could come up.
Mhm.
Yeah.
It's interesting. This is kind of an aside, but I'm realizing like every conversation I end up having with clients around mindfulness, that's not like meditation conversation, but exactly what you're talking about of like just being aware of what you're doing when you're doing it. Every conversation I have around that involves us putting down our phones. And
Mm.
I'm trying to remember before phones what we were doing that made us less mindful. Cause I know we weren't all walking around mindful in the 90s,
Yep.
Um, but just like what we were using to distract ourselves, maybe a disc man. Um, but I'm curious outside of this conversation, just like the impact of that of such easy, accessible distraction and such engaging distraction, how that has changed over the years. And in our, like, if we were to measure mindful moments throughout a day, if it's significantly less or if it's just different.
Mhm.
I don't know.
It's a really good question. And I think that is something, I mean, I don't know that I have a good answer to it, but it's something I've also thought about, like how has that changed the experience for people? And they might, and then that, is really relevant to the ACT concepts too, of like, you might have an uncomfortable emotion or thought, and that might cue you to go to your phone and start like trying to
Mhm.
distract yourself to avoid that thought.
Mhm.
The content on the phone could also be distressing or
Yeah.
bring up other negative feelings or emotions. Or like an hour goes by and you're like, oh, I just was on my phone for an hour. Like now I don't feel that wasn't consistent with my values. That was not fulfilling or meaningful. And then starting to feel worse about yourself and your behaviors. So it does seem, yeah, it's an interesting kind of paradigm shift when we think about what that means for psychological well-being and functioning. And yeah, a lot of research happening, I think, in that area now.
Absolutely. Yeah. So can we talk some about the core components? We've touched on some of them, but the core components of ACT and um, why those are really, really helpful for people going through perinatal mood disorders.
Mhm. Yeah, so there are 6 core components of ACT, and all of these 6 components support this idea of psychological flexibility.
Mhm.
So we have mentioned some of them. So one of these components is acceptance.
Mhm.
And so psychological acceptance refers to this idea that we can embrace and be open to both our internal and external experiences without making attempts to change or avoid or suppress.
Mhm.
And so this can be really difficult, and it's a practice. It's not like it's something that you do one time and you're like, okay, I engage in acceptance, like check, you know, it's kind of like a life philosophy and a life stance. Like I'm going to be open to all of the experiences that are happening and everything that I'm feeling and that I'm thinking, and approach that with curiosity and really truly embracing it without trying to change it.
Mhm.
So that's one of the components that that is used in ACT. Another one is this idea of cognitive diffusion.
Mhm.
And so with cognitive diffusion, this is the changing our relationship to our thoughts. So we may notice that we have a thought, and similarly to acceptance, instead of trying to modify it or change it or get rid of it, we allow it to be there. So we notice it, we experience it, but we create space in between ourself and our thought.
Mhm.
So another one is this idea of self as context. And this is a really abstract concept, but the general idea of it is wanting to convey this point that you are not your thoughts and your emotions.
Mhm.
There is this observing self, this self that exists as the context for the thoughts that you have and the emotions that you feel. So that, sometimes people feel really overwhelmed by the thoughts and the emotions, but
Mhm.
recognizing that like there is a you inside that's experiencing those and that they're separate, like from who you are as a person. So that can be really powerful. One of the metaphors that I love about this, to convey this, is this idea of the sky and the weather.
Mhm.
So like, if you imagine that your different emotions and thoughts are like weather patterns in the sky. So it's like a thunderstorm over here, and like over here it's sunny, and there's like a hurricane happening here. And you kind of get patients to talk about what those storms or those, weather events feel like. And then you arrive at this idea that they are actually the sky,
Yeah.
and they are the context in which like all of this is happening. And the weather can't hurt the sky. Like the weather is happening, but it's not the sky. And the sky is big enough to contain it all and to hold it all.
Mhm.
And that, I think, is just like a really beautiful way of describing that. And can help people to feel like, yeah, I might be having these really distressing or uncomfortable thoughts, but like I'm the sky, it can't hurt me. I'm separate from that. I'm bigger than that.
Yeah.
So that's a nice process, I think, when, yeah, we're talking about postpartum individuals who are feeling like they're losing that sense of themselves
Mhm.
in parenthood, that can really help to kind of bring that into focus. And then there's three others. So we talked about present moment awareness a little bit. So this connection to the here and now might look a little different from other applications of mindfulness. So with ACT, it's not intended to be a distraction. It's not intended to be relaxing, although sometimes that does happen, like that's a byproduct of it. But the goal is really to just be aware of what is happening in the present moment and to notice and non-judgmentally experience whatever is going on.
Mm-hmm.
So this I've found to be really beneficial during the postpartum period because oftentimes you're stressed, you're going through your day, you're taking care of all these tasks, you're like thinking and planning and, and sometimes then you realize like, wow, I just spent all this time with my baby, but I didn't actually even notice it or I wasn't aware of it. And so this connection to present moment awareness can help people to feel more fulfilled in what they're doing. They can get some more pleasure out of activities. I've talked to so many moms who are like, yeah, I like was like eating lunch so fast, like I didn't even taste it. Like
Mm-hmm.
opportunity for self-care and like enjoyment of something,
Yeah.
but they're aware of it. The mindfulness aspect wasn't part of it and they totally missed it,
Mm-hmm.
So I think that's really good. And the other way that mindfulness is helpful with respect to ACT is also just helps to create this space between your reaction and your response.
Mm-hmm.
So allows you to slow things down so that you can notice, like, I'm thinking this, I'm feeling this, and I can make a choice about how I want to behave. So don't have to feel like you're just like moving through the world, kind of reacting to things, but I can really notice, tap into my values, tap into how I want to be showing up in this moment and be able to make that kind of choice that's in service of those values, which can help, to move you closer to that rich and meaningful life that you want.
Mm-hmm.
And so, yeah, values is the fifth one, which is identifying like what is the most important, most meaningful, what is kind of like the life that you want to be living and what brings purpose and fulfillment, to your life. What are these things that are so deeply important to you? And how do we bring our behaviors more in line with those values?
Mm-hmm.
So that the things that we do and how we spend our time really support that. I think this also really connects to what we were talking about in terms of the like cell phones and social
Mm-hmm.
media. We will ask people when we're trying to identify and clarify values, like when your kids look back on their childhood, like what do you want them to say about it?
Mm-hmm.
Want them to say about you and how it was. And you don't say this in like a punitive way, like to show them like, oh, look, you're not doing the right thing. But it's more like you're wondering, like you're curious about what is happening in my day-to-day life. And does it really reflect the things that are most important to me?
Mm-hmm.
So maybe like you're spending all your day like cleaning your house, like in the moment that might feel really important, but like do you want your kid to be like oh, my house was always really clean as a child, but or do you want them to say like my mom like played with me and we had these moments together and and that kind of connects to the phone use too, like how much time did you spend on your phone and is that really consistent with your values? So just a couple examples, but I think that can be important. And then the final one is this idea of committed action.
Mm-hmm.
So that's really putting it all into practice. It's like the behavior changes that reflect everything that we talked about. So it's being able to really to be committed to the behavioral changes that are implied by all of these different processes and remaining committed to that in terms of like this ever expanding pattern of action. So
Mm-hmm.
it's not just doing it one time, but this is like a continual process.
Mm-hmm.
So yeah, so those are the six core components and kind of how they relate to the perinatal experience.
Yeah. And I think about it almost feels, as you describe them, it almost feels like it was created for the perinatal population, like it
Mhm.
works with everyone, but it's interesting how well suited it is to people that are genuinely in this like temporary discomfort. Like this discomfort isn't going to last forever, which makes it slightly easier to accept. Um, and because it's temporary, it also helps with the diffusion and with the self, as contact, like all these different pieces, it falls into place in a lovely way.
Yes,
Um,
absolutely. I know I always like to say like it's temporary, which is both a beautiful thing and it's also a really like sad thing, when you think about this time period when you have a baby and or when your kids are young, like like hold on because it goes by fast,
mhm.
which is both sad and also a relief, in some way.
Right.
And
Yeah, when you're in that misery, absolutely. Yeah.
being able to experience all of that and hold all of that. Like it's okay to feel, all of these different emotions around it. And I think that's important to validate, for people as well.
Yeah.
Mhm.
Yeah. And whenever anybody's suffering, it always feels like forever. Even if this is like a temporary hormone glitch combined with all these life changes and I'm getting support, I think anytime any of us get really sunk into our suffering, because I think we're probably all suffering at some level all the time, but when we're really sunk into a deeper suffering, it's hard to, there's the fear that it will always be like this. And then it's hard to pull ourselves out, which is then another thought diffusion situation of like, oh, that's a thought, you know? But
Absolutely.
yeah.
I think it can start to feel really hopeless. It can start to feel really, yeah, like things are never going to be different. Things are never going to change.
Mhm.
And those early days, like, yeah, they are really dark. And babies, newborns, like they don't give you a lot of feedback about how you're doing. Like
Right.
they cry and you feed them and then, so I think that is hard for a lot of people who are used to operating in a world where they get feedback or they like accomplish tasks.
Hmm.
Having a newborn, you're like you change the diaper and then you change the diaper again and then you change the diaper again. Like there's no
Hmm.
kind of like I mean, there's accomplishment, but it's so different
Yeah.
what people are used to. And I think that's another way, you can help them practice that acceptance and that diffusion around those expectations and
Hmm.
needs and because yeah, it's difficult.
Yeah. And I think about especially people who have like colicky babies or are really, really wanting to breastfeed and it's not going well. You, if you feel like your only job is to get them to stop crying by giving them what they need, and you can't do that,
Yeah.
because they're colicky and all you can do is walk around in a circle with them and hope it helps, or you're trying to breastfeed, but the latch is off or whatever. Like it can feel like failure at a thing that like, I don't know why any of us thought that should have come naturally. Like it's just, it's both learned and it's luck.
Yeah.
Um, and sometimes you're not going to get one of those. Sometimes you're not going to get the education and sometimes you're not going to get the luck. And people around you may be getting both, and that can be really hard.
Yes, right. And that's the social comparison,
Hmm.
which can, I'm like, you never know what other people are dealing with.
Right.
And sometimes you feel like, you're really alone and isolated and you're the only one having this experience. And so that must mean that there's something wrong with you as a parent but yeah, there's so much luck that goes into it. And it really,
Absolutely.
you can be doing everything absolutely that you can do. And babies might still cry because that's what babies do. They just cry and we might not like, there's not a deficiency or something that is wrong,
Mhm.
what you're doing. And so that I think helps also when you think about that from an ACT perspective, like we can experience this and not interpret it or not even try to find the truth in it, because with ACT we're not trying to determine if this is accurate or if it's true or if there's a more adaptive way to think about it. It's
Mhm.
what's helpful and effective, and
Yeah.
that's really what becomes important. What's helpful, what's effective, what is values consistent, because some of these questions we don't have answers to. We won't be able to know. And we also like, yeah, it just in some ways, like it doesn't really matter whether we can, determine evidence for or against something. It's more just like, yeah, what's helpful and effective in this moment, and
Mhm.
consistent with the kind of parent that I want to be, the kind of person I want to be, and how can I show up like that because it's in service of my values.
Yeah. Yeah. And that also takes a lot of being able to access your mind, which
Yeah.
can be very hard when you're underslept and you've got a baby crying in your ear and it feels like the weight of the world is on you. It's
Mhm.
so, it really does, in my opinion, require help. Like it requires a therapist who knows what they're doing and or partners and friends and parents and whomever is in your support system to be able to help get you through,
Mhm.
which requires a vulnerability of being honest about what you're going through, which is hard. Yeah.
Yeah. Yes, it's very hard. And I agree. Yeah, it does, having somebody being able to provide that structure and that context and teach you those skills.
Hmm.
Uh, I think in ACT, I mean, I don't tend to use the word skills a lot because I don't like to think about it like, here's a fix or here's something that like a tool that you're going to use, because it's kind of the ACT perspective is a little bit different. But I think it can be helpful to have somebody who can provide that perspective,
Hmm.
really engage experientially with you in the therapy space, and then help you to see like how you can apply that in different experiences that you have. So yeah, and I think also, like you were saying, bolstering social support is really important,
Hmm.
helping individuals to feel that their emotions and their experiences are acceptable, and
Hmm.
it's okay to feel vulnerable and it's okay to ask for help. And that's often something that people are really hesitant to do because of the stigma and the shame.
Hmm.
It becomes incredibly important to get that on board.
Absolutely. And I think about programs out there that help bolster that social support along the way. Like our birth center had like group appointments basically, where they, instead of saying the same exact thing 30 times in a day, they had like a group of people who were giving birth in the same month,
Mhm.
or whose due dates were in the same month. And we became a crew, we really like were, especially around the time everybody was starting to give birth, it was just so exciting.
Yeah.
And so we had this group of people before we even gave birth, or I gave birth, that was me, before I gave birth, that um some of them had given birth and they were talking about something like recovery. I learned about recovery right before I gave birth and was like, oh shit. But to be able to talk through some of those things with people going through it at the same time. I was the only one who had PPD, but I was supported. And then there was another group I joined, shout out to Seattle Peps, which is like a group of the same kind of thing as women in a zip code who were giving birth in the same month. And we got together 6 weeks after birth, basically, or 6 weeks after that month started. And so we were meeting while we were in the fuzz of like, I don't know what I'm doing. Do you know what you're doing? And then there was like an elder mother who was probably 40 or something, but there was like an elder there to help us. And we also became a crew. And I was also the only one struggling with PPD there, but it was a safe place to talk about it. And both the places where I talked about it, there were supports in place, in either the companies essentially to get help for you if you needed it.
Mhm.
So
Valuable.
yeah.
That's great to be able to just feel like you have people who understand and who are going through the same thing,
Mhm.
and really yeah, I think that it can help in terms of easing the transition to
Mhm.
role and the new identity, and just that shift, and feeling like there are people who get it and who can support and like celebrate those little wins.
Mhm.
um
Yeah.
I remember the first time my best friend, and she didn't have a baby at this time, but she was like, we're going out, we're going to Target, and like she helped me like get the stroller set, like figure out how to fold the stroller up and put it in my
Uh-huh.
are. And like, I remember like that was life-changing for me, just
Mhm.
having that support from somebody to be like, yeah, we're just going to leave the house today with the baby. And I was like, what's going on?
Uh-huh.
And that was a big deal. But like, for everybody else, it's like, okay, you left the house, but I think you have to have people around who get that and who
Yeah.
can kind of, yeah, just help you and move closer to that, right? And that's
Mhm.
that's a way that the values sort of kick in. Um,
Yeah.
it's easier
And
to stay home. It's easier not to text that group of friends. It's easier not to, be vulnerable. But like, is that really the life you want to be living?
right. And it's easier partly because of all the things going on, but also the learning curve is just so steep for freaking everything in a
Yeah,
way that I can't remember having a learning curve that steep and that fast. And to not be surrounded by other people who have been through it or going through it, it's hard.
yeah,
Um, yeah, and I think about, tailoring care to kind of individual personal characteristics, like those moms who really want to get it right. Or um, different reproductive histories. I think about,
yeah.
honestly, most of my friends who've had some some help medically to be able to either get pregnant or maintain pregnancies.
Mhm.
And there's more fear on their end. I know there was a lot more fear of miscarriage for me with my second because I'd had multiple miscarriages in between my kids,
Mhm.
and how I was afraid that was setting me up for postpartum anxiety. And just how can you tailor care based on those specific clients' needs
Mhm.
within the structure of ACT?
Yes. Yeah, I think ACT is really flexible and very experiential. And I think in those ways, that does really help to be able to tailor the care and to really meet people where they are.
Mhm.
The 6 processes that I described, there's no like order that you have to move through them or no
Mhm.
like place you have to start. And as you learn more about them, you see like how interconnected they are, which I think that really helps you to be able to kind of tailor things. There's no particular like way that it has to flow.
Mhm.
So I found that to be really helpful. And I think, yeah, certainly being able to talk about values and talk about the kind of life that you most deeply want to create and live, that really helps you to design and develop, a treatment approach or interventions that are going to reflect what people need in that moment.
Mhm.
And that emphasis on values and just that always holding the value as like the guidepost. Um, and it's not, my value as the therapist or, society's value, but it's like, yeah, what is really deeply, most meaningful and important for you? And what would a fulfilling life look like for you? And then helping people to create that, is really rewarding.
Mhm.
Um, I think your point about, yeah, people who've had different reproductive challenges or experiences and how that might contribute to anxiety, for example, um, and being able to help them notice how those prior experiences are affecting them,
Mhm.
that what that looks like behaviorally, and is that something that again is keeping them from moving closer to their values. So I'm thinking of, you had mentioned like some people who maybe want to do it right or do it perfectly. People who feel like I've had a lot of losses. And so this is like maybe my one chance and I want to make the most of it, or I want to have it feel a certain way or look a certain way. And helping people to see like, okay, this is what is happening in my mind, and what is that costing me? And is that actually moving me closer or farther away from my values? I had somebody that, people that I have worked with who, were kind of really anxious about different experiences and used that to dictate like places they would go or things they would do, because they had in their mind that they had to do it a certain way. And if they couldn't do it that way, then it was like not worth doing. And
Mhm.
so being able to really like examine that and talk about the unique histories and the reasons why they're having those thoughts, but noticing that, again, the thoughts don't have to dictate our behavior, and they don't have to reflect, what it is that we choose to do. And I think that has been really helpful for a number of people too.
Absolutely. Yeah. And I think about just like values-based living in general, and how sometimes it's hard for us to pin down our values. And if this is somebody's first time trying to do that, when they're maybe not as well slept, they're having a hard time thinking, there's brain fog, all those kinds of things, how do you help them think through identifying their values? What are some ways that you make that more accessible to them?
Mhm. Yeah, so it can be difficult to be specific about values, or to really think about what's important, especially people who maybe have, because in the way that they're trying to manage like depression and anxiety, they're so focused on, I want to feel better, I want to get rid of the anxiety, I want to get rid of the depression, that then they lose touch with what really is important to them. And so it can kind of cloud their ability to see clearly, and think clearly about what it is that they want. So I do a lot of psychoeducation around what values are, the difference between values and goals. So describe it like, goals are like things that you can check off. It's something that you can have or not. But a value, it's like a direction. So it's like you're moving east. You can always keep moving east. Like, you're never going to get there. It's just the direction that you're moving in. And then the goals become like little, check marks along the way that support that overall, value. So I think framing it like that, talking to people about, like, if a value of yours might be education and learning, maybe getting a college degree is a goal that supports that value. But you can always be learning, and you can always be, educating yourself and having new experiences. So I give a lot of like practical examples like that. There's also different kinds of exercises. There's a values card sort, where there's a number of different values that you present, and then people can sort them in different ways and prioritize them. Values compass is another kind of useful like way to think about values, where there's a list of different life domains, and then using this compass like framework, how do we I guess like identify which values are more prominent for us, and which are some areas that we might be not as aware of, and how do we see our behaviors fitting into that. And I also do just kind of a lot of, like I had said before, when your child looks back on their life, or when you look back on your life, like, what do you want it to have stood for? Like, what do you want to be able to say about it? And sometimes that can bring some things into focus as well for people, which is really helpful.
Absolutely. I think about I think just for anybody listening, just taking a moment to think through that. Like, I know for me, I spend more time on my phone than I want to. Like, that is outside my values in a way that I don't want my kids to, their vision of me in their head, I don't want it to be like the top of my head as I'm looking down at my phone. I want it to be of me smiling at them. I want it to be of us like playing or engaging in some way that has them feeling loved. And that's often the driving force. If I'm like, oh, I'm on my phone, I need to put it away, or I need to use my app that blocks my social media access or whatever. That's usually my driving force, is my kids. I'm wanting them to have memories of me, not the top of my head.
Yes. Yeah. And it's such I mean, the transition to parenthood, it's such a unique time. And I think often a time where people start to take stock of their life, and, like, it's because it's such a transformational shift. I found that people are really almost like primed to connect with values and so it's like a great opportunity to really bring that into it. And they're sort of already like reconsidering their life, and, it just often does kind of work perfectly to be like, okay, so yeah, let's really, think about how you spend your time. And And I think, like I said before, not in a punitive way or a way of like, I'm judging you for being on your phone, or I'm judging you for doing this or that. But yeah, I wonder, what might be different if we made that change. I wonder, and
Mhm.
again, being curious and open rather than going through it from this posture or this stance of like, oh, now I'm the worst mom. Look, I'm on my phone all day. Like, this is terrible. Taking away that judgment and just noticing and yeah, trying to see how you can bring those behaviors more in line with the values.
Absolutely. I feel like we've had such good, rich, like conversation about both ACT and perinatal uh, disorders and how the interplay of the two. Is there anything you feel like you really want to make sure therapists know
Mhm.
going forward?
Mhm. Yeah, I think it's important to, if you want to work in this space and you want to work in this combination of ACT and seeing perinatal patients, yeah, I think it's important to kind of think about your own experiences and, you know, as an ACT therapist, you are, as a human being, subject to the same dilemmas of living and the same pain and the same suffering and the same psychological inflexibility, right, that our patients experience or our clients
Mhm.
experience. And so, yeah, I think that is an important piece too, is to think about how you show up in the therapy room. And the experiential nature of ACT, I think, really helps to cultivate this sense of like, we're in this together, like
Mhm.
we're on the same level here. We all experience these things because we're humans and life is hard. And being a human means that we're going to have negative thoughts and negative emotions, right? Like there's nothing special about me because I happen to be sitting in the therapist chair and you're in the client's chair. Like, we're all kind of in this together. And I really, that approach really resonates with me. And I think it can be an important way of being able to provide that empathy and that non-judgmental acceptance and that validation and just knowing, yeah, that life is really difficult and what people are experiencing and is not aberrant or abnormal or dysfunctional. Like it's just life.
Mhm.
And so,
Yeah.
yeah, it's kind of what I would say as a starting point, for people wanting to do this kind of work. It's very rewarding, it's very validating, and you have a lot of opportunity to have long lasting effects that really benefit not only your client, but their children, their families, their communities. So yeah, it makes
Mhm.
a difference.
Yeah. And it's my bias as somebody who's been a client for PPD that's also a therapist that I feel like therapists wanting to work with the perinatal population need specific training in the perinatal population. Is that something you agree with?
I do, yes. Yeah, I do think it is important to have specific training in this area. And there's a lot of great organizations that have different certifications and that provide opportunities for increased training. But I do think it is such a vulnerable time and such a unique like phase of life that
Mhm.
it's important that you do commit to that ongoing education and training if this is an area, that you want to work in.
Yeah, amazing. Alexa, thank you so much. I really appreciate it.
Yeah, thank you so much for having me. It was a great conversation and I really appreciate it.
Have a really great day.
Thank you.
I hope that broadened your clinical horizons. Head over to notboringces.com to get your CE credit. Want to have a not boring conversation with me about your clinical area of expertise? You can apply there too. If you like this conversation, leave us a 5-star review, tell a friend, and be sure to subscribe for future conversations.